All right, we are here with Dr. Aakash Thakral. He's a pain medicine physician in Washington, D.C. He's been here for a little over 2 years and is currently seeing patients out of International Spine, Pain, and Performance Center. His residency was in physical medicine and rehabilitation, and then also had an extra year of fellowship training in physical medicine and rehabilitation. I screwed that up. Hold on. We're going to go back.
No problem, no problem.
I lost my line there.
You're good.
All right, we're going to start over.
Sure.
All right, we are here with Dr. Aakash Thakral. He is a pain medicine physician in Washington, D.C. He's been in D.C. for a little over 2 years, and he's currently seeing patients out of International Spine, Pain, and Performance Center. He did his residency in physical medicine and rehabilitation, and then followed that up with an extra year of fellowship training in interventional pain medicine, which in layman's terms is non-operative treatment for musculoskeletal and spine conditions, which is what we'll talk about today. So, Dr. Thakral, thank you so much for joining.
Thank you. Thank you, Jesse, for having me. I'm looking forward to it.
Of course. We're a physical therapy company that loves to help people exercise. So the first question I always like to ask people is, if you could only do one type of exercise for the rest of your life, what would it be?
Good question. I love tennis. I played tennis my whole life, grew up playing it, started at a young age, so I would probably say tennis.
Nice. Do you
Yeah.
play competitively or?
I played in high school, played a little bit of club tennis in college, but not too much competitive after that.
Okay, got it. All right, so great. So, we use a lot of big words like interventional pain medicine and physical medicine and things like that. So, just to break it down and make it really simple. So, what type of person or condition do you like to help the most, or do you see the most?
Yeah, it's a great question. We see a lot. We see patients from that are young with acute injuries, sports injuries, patients, much older patients sometimes with debilitating arthritis or difficulty with mobility, and I think we see all sorts of it. In terms of what I like seeing, I think that's part of what I like doing is the fact that we see the whole breadth of it. But I think the patients that I guess I would say I like seeing the most maybe is patients that are just motivated to get better. I think it almost seems intuitive, but it's not sometimes, right? So patients that are motivated, want to get better, or involved in the process, that's probably what I would say is are the most exciting for me.
Got it. Okay.
Yeah.
Yeah, and so it sounds like all sorts of conditions. And so, do you have one or two recent success stories of someone who's able to get back and get out of pain, so that people can kind of understand kind of in the process of what happens?
Yeah, definitely. I think one of the, some of the more common things we see in our practice are back or spine, neck related, but we see all sorts of musculoskeletal injuries, and we deal with the non-operative treatment of it. So I think one of the most common things we see are radiculopathies or pain that's traveling from somewhere in the spine, whether it's the neck or the low back, and into an extremity, so into an arm or into a leg. I think off the top of my head, there's one patient I recall a couple months ago, middle-aged female, a very kind of a weekend warrior, right? Loves working out, very active, and started developing pain in the neck and kind of in the scapular region and into the arm and into the hand. Um, had done a bunch of physical therapy prior to seeing me and didn't seem to help very much. So she came in. We got some imaging, including an MRI of the cervical spine, which confirmed that she had a disc herniation that was in the cervical spine that pushing on or pushing close to the nerve root in that area, which was what was causing the pain and her symptoms. And so she came in pretty discouraged just because she's had done a lot of things already and things weren't getting much better. So we supplemented that with an epidural steroid injection. One of the more common things we do in our office. It's a injection done under X-ray guidance to try to help relieve some of the inflammatory aspect of the pain and symptoms that she was experiencing. She got back into physical therapy the following week. And granted, it took several weeks for it to get better, but it did get significantly better. And I've kept seeing her over the past few months, and she's doing a lot better. She's back doing the workouts and things that she loves, so she's doing great.
That's awesome.
Yeah.
Do you know what kind of workout she was doing? I'm always curious about that.
Yeah, she's a big runner.
Okay.
She loves running, and she uh, obviously she did have to pause it for a little bit, but now she's back to running and doing everything that she was doing beforehand.
That's great. So there's a few things there. I just wrote down a couple notes that
Yeah.
want to kind of tap into. So you mentioned that she had a herniated disc. I
Hmm.
think one thing that we hear all the time when people are told they have a herniated disc is they're told they have a herniated disc and they think, well, I just have a herniated disc the rest of my life and there's nothing to do about it.
Hmm.
Do you hear the same thing from your patients as well?
Yeah, yeah, we hear that a lot, and it honestly there's it's very variable. I mean, we've that can be the case sometimes, but there's often times where things like a herniated disc can get better on its own with number one, time, number two, a good physical therapy, and that's where you come in. Um, and what we're doing is it's kind of a team approach. If we can calm down some of the pain and inflammation from our end and get them back into seeing someone like you and hopefully get them over the barrier, and then that plus time, oftentimes disc herniations actually resolve on their own, or your body reabsorbs some of that disc material, or it comes back into place on its own. Although that is a common, I would say, misconception, it can get better. Obviously, every patient's different, but it can get better on it with those measures.
Yeah, I love that you're saying that because we try to tell people that all the time and they don't always believe us. But I think it's really important for people to understand that hey, you have this disc herniation. It can get better. It doesn't mean it's a like life sentence of pain or anything like that. So I love that. I love that that's the story you used.
Yeah, yeah, definitely.
And then the other thing I think you mentioned a steroid injection. Even sometimes when we get to a point where we think someone could benefit from a steroid injection, one pushback we get a lot is they they don't want to just mask the pain. They don't want to mask the pain. So could you speak to that a little bit? And does a steroid injection mask the pain, or what does it do, or what are the benefits?
Yeah, it's a great question because I hear that every day, honestly.
Yeah.
And there's multiple reasons why people can get something like a steroid injection. Granted, the duration of the steroid itself or the injection itself, that does not last forever. It is temporary. The relief is probably temporary. But depending on the reason we're using it, and in this case for someone with a younger patient with a disc herniation, the goal is to kind of control what we can control as conservatively as possible. As long as patients don't have any of the big things that would require something like surgery, which sometimes is necessary. But if we can kind of control everything we can control the inflammation, control the pain, the goal is that they can get over this barrier, over this hump, through some of the more conservative measures like working with you and doing certain sets of exercises that can help more long term.
Yeah, yeah. I tell people that all the time. It's not the injection itself isn't necessarily the full solution. It just is a bridge to get you to the next step where
Hmm.
you're kind of at this crossroads and you can't get to that next step. But the steroid injection gets you over that hump, and now you can do all these other things, and that's going to be the thing that gets you there. So I get that pushback all the time. I'm sure you get it more than I do, but it's just interesting that I hear it from my end. Even as a physical therapist, sometimes I'll say, hey, I think you should go, speak to Dr. Thakral about an injection, and I get that pushback all the time.
Yeah, yeah, no, I get it. We both hear it from both of our ends, so
Yeah.
I get it completely. Um, one of the other things that I think, or if you don't mind me adding
Yeah, go for it.
another patient that I just thought of is, sometimes we talked a little bit about steroid injections and things that can help with pain and inflammation, but there's a big or there's a lot of research and a lot of things, a lot more interest in regenerative or biologic options these days, and there's a lot of patients that are good candidates for things like that, and the one I'm thinking about right now is also another. Kind of like a younger middle-aged female who loved playing tennis, similar to myself. And she had a lot of shoulder pain, dealing with it for years. She came in, also had done a ton, like years of on and off physical therapy, and although there was improvement, it wasn't, it would come back, right? And you probably see that a lot. So we finally got some imaging. It showed some tendinopathy or tendinosis, like a chronic tendinitis in the shoulder and the rotator cuff. Um, And that's actually a great indication for something like that, where we actually did do a steroid injection once to try to help control the pain, control the inflammation, see if we can get her over the barrier, and continuing working with physical therapy. And it did temporarily, and she was a great candidate for something more regenerative. So, and what I mean by that is, so we did a PRP injection. PRP is platelet-rich plasma, and that's your own body. It's using your own body, or using your own blood cells to try to or injecting that substance back into an area that has an issue, essentially, and trying to promote more blood flow and regeneration to the area to help your body heal up on its own, essentially. And so that's what we did with her. And there's a lot that goes into that as well. And there's a recovery time, and she did a lot more physical therapy. But I think it was like 6 months, or sorry, 3 months later, she was back to playing tennis, and pain was significantly better.
That's awesome.
Yeah.
So, yeah, I have patients, asking more and more about regenerative and biologics and things like that. So, who do you think is a good candidate for that biologic approach or that regenerative approach?
Yeah, I think it there's definitely a sweet spot. There's definitely an area where, sometimes we get the question of is it worthwhile doing something like a PRP injection or something more regenerative for like large, for in this instance, like a large rotator cuff tear or severe osteoarthritis. And although there's a potential that it could help, I think that that's probably not the best indication. So the patients that typically tend to do better with biologics or regenerative options tend to be um, younger, middle-aged, and not with severe findings. So things that are like in that mild to moderate category of findings on imaging. And the best indication, actually, a lot of times are tendinopathies. So where like the rotator cuff's a great example, tennis elbow's another great example. Patients do very well with those conditions, and arthritis, osteoarthritis, like in that mild to moderate category.
Got it. Okay. And this might be a harder question to ask, or maybe it's not. So I'm curious. Are there certain people that you think are good candidates for the steroid injection as well?
Uh, do you mean, are those patients good
No,
candidates?
no. Is there a separate group of people that might be a good, maybe they're stuck just like your first success story. Maybe they're stuck in, is there a certain group of people that you think are good candidates for a steroid injection to help them improve?
There are, and that kind of goes back to what we were talking about. Is a lot of times that technically, or that's considered a little bit more conservative, like a steroid injection, more mainstream, maybe. And that's why a lot of times we start with something like that. And if the symptoms return, and if they have a condition that might do well with the regenerative option, then we can move on to something like that, because there's other nuances involved in it as well. Most insurances don't cover things like the regenerative or biologic options. So a lot of times, depending on the patient as well, we would try something a little more conservative. So there's other reasons as well, but yeah, a lot of patients can fall into the category of possibly benefiting from either one.
Got it. Okay, that makes sense. And both of your success stories, um, this is not I don't mind this at all, but both of your success stories were people that didn't have success with physical therapy. Is that fairly common for you, that people are coming to you after, maybe it's not physical therapy, maybe it's chiropractic, maybe it is physical therapy. Is it
Yeah.
common that people are coming to you after trying one or two things and they're kind of stuck?
Yeah, it's a great question. I mean, we see a lot of different things. So I do have a fair share of patients that come in for the first time without having seen anyone else. We have a lot of patients that come in that will have seen a list of 15 other providers in the past, and nothing has helped. So, and there's most patients which are somewhere in between that. Um, but a lot of times we do see patients that have tried other conservative measures, and eventually were sent to us, or found us because they haven't seen the results that they've wanted to see just yet. And like I said, a lot of times it's just kind of adding to that, where we're trying to use a whole host of, or a whole different specialties, whether it's you, or whether it's a chiropractor, or whether it's an orthopedic, and ourselves. So there's times where patients can benefit from a whole team.
Yeah, that was actually a point I wanted to touch on. You've mentioned now a few times a team approach to helping these people get better.
Hmm.
So are you often working hand in hand with a physical therapist or an orthopedist or a primary care? Is that common for you to kind of be working with or for one of your patients to be working with multiple people at the same time?
Yeah, definitely, definitely, and that's one of the, I guess, harder things in medicine and in healthcare these days is the communication between providers, and I think that's something that is very important. It sometimes what the way you and I speak might be a different language to than someone else, and it's a lot to take in, and there's oftentimes gaps in communication. So, and we've exchanged several emails in the past about patients and updates, and same thing goes for primary cares if the patients are seeing their primary care or an orthopedic or an orthopedist, and that's typically it's very important.
Yeah, I think that's an awesome message because we find a lot of times people feel stuck because they don't know what's the right approach, right?
Hmm.
So they're thinking, should I do physical therapy? Should I go see a surgeon? Should I try an injection? Should I go see Dr. Thakral? And I think people get overwhelmed with the amount of choices, and so they almost choose nothing because they don't want to make the wrong choice. So
Sure.
what I try to tell people all the time is, hey, you don't have to make the perfect choice. Come to us and go to Dr. Thakral and get an opinion from a surgeon at the same time. There's no reason you have to choose one thing. You can work with people that are going to talk to each other, and if they're all talking to each other, you're going to get a better option because now you've got multiple opinions on what's going on.
Yeah, yeah, I agree completely. I tell patients that all the time that honestly, the more eyes and the more opinions, honestly, the better. It's in their best interest to have a different set of eyes on evaluating everything, whether it's their exam and their imaging. I think that's always beneficial.
Yeah. So I just always tell people, you don't have to make the perfect choice. It's okay to try, talking to two or three different people
Hmm.
to come up with the best solution from everybody.
Yeah, yeah, definitely.
So one thing we like to do is there's a lot of misconceptions about physical therapy and just fitness in general and health in general. So we like to bust people's myths and misconceptions. So is there something that you like to bust people's myths with when they come in, or anything any of your favorites?
Um, let's see. I think one thing would be trying to keep in mind the big picture. It's really easy. It's very easy to kind of get bogged away in the details, and one day of increased pain or 2 days of increased pain sometimes, which I'm sure you see a lot. Um, uh, it's not the goal is to make incremental improvements. And there might be good days, there might be some not so good days, and as long as the trajectory is still up, even if it's just mildly up, that's the goal. So keeping or remembering the big picture is very important. I think the other thing is the preventative aspect to a lot of injuries. It's in the nature of what we do is we oftentimes see patients after they've had an injury, same thing as you, and I don't think there's enough emphasis on the preventative things that people can do to avoid injuries. And if that was the case, we probably would be, there would probably be, I mean, there would definitely be a lot less injuries and a lot less, yeah, injuries per se. And I think that's a big thing because if there's there's a lot of stretching, a lot of exercise programs, a lot of things that can be incorporated on a day-to-day basis that could probably help limit or avoid some of these injuries that patients are having.
Yeah, I think that's great. I want to touch on the big picture thing in one second, but
Yeah.
so if people are trying to take that more proactive approach, which is something that we work with people all the time on, what would you recommend to people on ways that they could, take more proactive um, measures to, limit their injuries or improve their health or things like that?
Yeah, a lot of it actually is starting to get or starting to kind of get working with you and, and physical therapy. I think there's especially in over the past few years, a lot of people work from home now. A lot of people are probably not in the best supportive chairs and ergonomic setups, and I think remembering those things and trying to do the best you can on a kind of conservative basis on an everyday basis. That's where I would start.
Yeah, I think working on just getting up out of your chair. That's a great place to start. Because like you said, everybody's sitting at home, working at home, and I find people are taking way fewer steps than they used to, and making different health choices. So yeah, just getting up and moving, I think, is great.
Yeah,
Going back to the big picture, I think that's a great message because being in pain really sucks. So it's really easy to have a bad day of pain and think that things are totally falling off the rails. My analogy to people always is your recovery is like the stock market, and if you looked at your 401k every single day, it might be up, it might be down, and you would drive yourself absolutely crazy. But your recovery is the same way. And like you said, just look for that trajectory upwards, and try to even out the good days and the bad days.
yeah, yeah. I think that's a great point.
So this has been great. So if you had one piece of health advice, or you just wish the people knew one thing, or you wanted to leave people with one thing, what would that be?
I I think that probably I would say movement is always good. Movement's part of the answer. I think just like you kind of mentioned, getting up, doing going for a walk, doing things that seem like they might just be so basic can really help.
Yeah,
Yeah,
I think that's great. I think people often think that they have to make these huge lifestyle changes or do something drastically different to get out of pain, and sometimes just going for a walk is a great place to start. There's
yeah,
research that shows just walking more helps a huge percentage of people in back pain. So I think that's a great message.
yeah, yeah. We have to start somewhere.
Exactly. Now this has been great. So if people are, struggling with pain and they've tried a few different things, or maybe they haven't tried a few different things, and they want to consider, injections or just your evaluation skills, where can people find you and where can they find more information about you?
Yeah, yeah. So the practice is called International Spine Pain Performance Center. We're in DC, downtown in DC on 20th and K Street, and also in Arlington, Virginia. And you're right. I mean, it could be at the very beginning, just had an injury, or more preventative, like we talked about, for more preventative reasons, or has done a bunch of things and seen many providers and can't figure out what's going on, or uh, there's an aspect to the like we talked about, a lot of interventional or injection options. There's medications. There's a lot of different options out there, whether it's the regenerative options or steroid injections as well. So yeah, there's many options out there, and so that's yeah.
I think that's a great message to leave people with is no matter how long you've been in pain or no matter what you've tried, there's almost always another option. So don't give up and just keep on trying and searching out great providers. So Dr. Thakral, thank you so much for your time. This has been awesome.
Yeah, no, of course I appreciate it. Yeah, it was great. Thank you.